Hi, I'm Prashant Natteru, neurologist at Mayo Clinic Health System. Firstly, thank you so much to the Seven Rivers Alliance for nominating me, and of course, my colleagues for nominating me for this Rising Star Award. Uh, how I felt about it? When I first got the email, honestly, I thought it was a phishing email and I wanted to report it. But then when I actually went through the email, I was like, oh, it's actually real. And that's when it hit me that I was being nominated for the award. So thank you so much for that. Why I think I was nominated for the award is because personally, for me, I have the philosophy that medicine and neurology should not just be confined to the hospitals and it should go out into the community. And that has been my motto that I've been practicing for the past 2 years here in La Crosse, where I've ventured out into the communities to try to spread information and educate our patients and also the general public about common neurological conditions like Parkinson's disease, stroke, or epilepsy. What I realized after I did this was a lot of people think of Parkinson's or several of the neurological conditions as a big stigma, as it's the end of life situation, like it's a death sentence, which is not true. That's something that I want to get rid of or bust the myth. In terms of volunteer activities that I've done, I've showed up at dairy breakfast with the farmers. It was hard to convince them to be careful with the pesticides because there is evidence showing that pesticides can cause Parkinson's. Small things do matter. In my clinical practice, when I talk to patients, I start with a simple gesture like, how was the drive this morning? Because most of the times when they come to the clinic, everybody's stressed, they're freaking out, they're like, what is the doctor going to give me? Is it a terminal diagnosis or anything of that sort? I think it's important to calm the nerves before we get started because that also helps us in understanding what they're actually here for. At the end of the day, what was important to me is getting out there and educating our patients about the common myths that they have about several of the neurological conditions, which helps them understand the disease better, but also helps them to seek care earlier rather than waiting for the stage where we can't even intervene. And that is most important to me. So I try to blend humor and medicine together. To me, a smile, a handshake, or with our patients, and just spending that extra time to talk with them, to answer their questions, allay their fears, I think goes a long way than fancy medications and fancy interventions, etc. Because in medicine, it's also important to, as much as it is important to treat, it is also important to take a step back and look at the bigger picture. Thank you.